Call the meeting to order. And, today we're here for the May 10th Monterey County Emergency Medical Services Agency bi-monthly meeting. Just real quick, do a roll call and then we will do introductions.
All right. Will Hiller. He's in today. Sam Clemick.
Here.
Jim Lineborg.
Here.
Harry Robbins.
Here.
Jody Schaefer.
Here.
Liz Garcia. Paul Wood. Nick Greenson.
Here.
Carlos Spencer.
Here.
Tina Nieto. John Anthony.
Here.
Alternates, Mike Esslinger.
Here.
Ben Harvey. Very good. Ex officio, Kelsey Scanlon. Teresa Rios.
Here.
Leanne McGoski.
Here.
Thank you. Yes, if you would like to announce your presence, you do not, is not required. And we'll start in the room if you'd like to.
Morning, Jeff Warner with CalSTAR.
Rachel Nealon, EMCC.
Nick Green's an emergency physician.
And I'm Spencer Arnett. I'm an MR paramedic.
Jesse Allard with the EMS agency. Deborah Hopkins, EMS agency.
Jeff Watkins, Carmel Police Department Chief, taking over for Tina Nieto.
Ryan Alexander, Salinas Fire Department Operations.
Justin Reyes, Monterey County Regional Fire EMS Chief.
Kimberly Hernandez, EMS agency. Karina Moreno, EMS agency.
Mike DeLeo, CAL FIRE BU.
And, real quick, before we get into public comment, I'd like to make the recommendation that we move new business up before we get into the reports. Anybody have an issue with that? All right. Go on public comment. Do we have any public comment? No. Number 3, approval of past EMCC meeting minutes.
Move approval of the March 8th, 2023 EMCC May minutes.
I'll second that.
Need a roll call. All right, roll call. Sam Clemick.
Aye.
Jim Lineborg.
Aye.
Harry Robbins.
Aye.
Jody Schaefer.
Aye.
Nick Greenson.
Hi.
Carlos Spencer.
Aye.
John Anthony.
Aye.
Mike Esslinger. Aye. Very good.
And on to reports. The MAC. We did receive the report from them. Jesse, here's anything he wants to report.
Yeah, meeting minutes are in the packet.
Do you want me to give any additional?
If there's questions, you have anything like that?
Mac has just a little bit of activity and we'll be back again next month. Spencer Harnett and Philip Brown, we would like to bring as primary members and move Christy Sobleski to an alternate role. And then in addition to that, there are a handful of primary and alternate members whose terms expires at the end of June of this year, who have agreed to continue for another 2-year term. So we're just advising and would appreciate an endorsement for those members as well. Names are within your packet.
Nothing from offices, the meeting was canceled.
Good. Moving on to EMS agency director report. We received your report. Teresa, do you have anything to add?
No, the only thing that I would like to is to highlight the fact that we are releasing a SWOT analysis. We conducted one SWOT analysis of the system back in 2021, and we're trying to update that as we engage in system design. We want to make sure that we cast a very wide net. So not only are we going to post it, we will also post it on our website, social media, but we want to encourage everybody in the system to please, do participate and complete the SWOT analysis. Get us your feedback, any ideas, comments, questions, suggestions. We welcome those. So that SWOT analysis should be released in the next couple of days.
So you're still able to take input on that?
Through the SWOT analysis.
Teresa, what's your preferred method of input? That
The form will go out if you can fill out the form and get it back. It'll have instructions on how to get it back to us. And the plan is to, once we gather the input, is to bring it to committee, the results of the SWOT analysis.
Okay, yeah, so go ahead and move to new business. At subcommittee endorsement. Yes,
Nothing additional from the report I gave, but appreciate endorsement of the members previously discussed.
we have a motion to move forward the recommendations.
I move for that we endorse the the nominees of MAC.
I'll second that.
Get a roll call.
Give me just a second, you're moving quick.
Sorry, too fast.
That's okay. I'm just trying to keep up, make sure that we get everything as we expect. So the motion, if I could put this into what I'm going to end up writing, the motion is to endorse for appointment to MAC, Spencer Harnett, paramedic with AMR to represent field providers, Philip Brown with Community Hospital to take over as the representative for base coordinator from CHOMP, Christy Soboleski to endorse her to be the alternate base hospital coordinator for CHOMP, and then continuing in the positions, Dr. Kolinsky as a primary for the CHOMP physicians with Dr. Reb Close being alternate, Dr. Noah Hawthorne being the primary member as a representative physicians for Me Memorial with Dr. Brian Darger as the alternate, Salinas Valley Memorial, Dr. Greenson will be primary with alternate who hopefully will come forward later. Philip Brown to be the base coordinator, which we talked about. Jamie Tovar to be the receiving hospital representative for Me Memorial with Michelle Villanueva as the alternate, and Cassie Caldera continuing as the base coordinator representative for Natividad with Chelsea Mettler being the alternate. That's what we're endorsing. And second, and therefore a roll call is Sam Klemick.
Aye.
Jim Lamborg.
Aye.
Harry Robbins.
Aye.
Jody Schaefer.
Aye.
Dr. Greenson.
Aye.
Carla Spencer.
Aye.
John Anthony.
Aye.
Mike Esslinger.
Aye.
Take care. Thank you.
Moving on.
I could do this one.
The next would be for the EMCC endorsement of EMS Operation Committee. Steve, you wanna?
Yes, I'll take this. As Blake is not feeling well today and he's not with us. So same with MAC, EMS Op Committee is, members are brought here for endorsement of the recommendation from the EMS Director, and therefore Spencer Harnett, who's introduced himself, he is coming on to fill the role of representing the primary ALS ambulance provider field staff to the EMS Operations Committee, and you will see his brief bio in the packet, the agenda packet. So we'd be looking for endorsement motion.
I move we endorse that candidate.
And I'll second that.
Any discussion?
Discussion?
All right,
Roll call.
roll call. Sam Klemick.
Aye.
Jim Lamborg.
Aye.
Harry Robbins.
Aye.
Jody Schaefer.
Aye.
Dr. Greenson.
Aye.
Carla Spencer.
Aye.
John Anthony.
Aye.
Mike Esslinger.
Aye.
Thank you.
Moving on, nomination and election of EMCC officers. Coming up on the end of the year.
I have a motion. I move we elect I place in motion the name of Paul Wood as our chair and John Anthony as our vice chair.
Paul Wood should have been here.
I'd like to throw something out there. I don't mean to nominate myself, but this has been very good for me and I've learned quite a bit, which has helped me in my job. So I know just speaking as a co-worker with Paul, how busy he is, hence he is not here today. But I would be happy if the group were willing to do this again for the next year. And again, really the motives are selfish for my learning, but I was just saying that.
I think we can speak for the group here. We appreciate the job that you've done over the past year.
Steve, I have been.
It's a team effort. Okay, any other nominations? Any discussion? All right, so we have two nominees for chair, which, thank you for two nominees. I don't know if I've ever had to do that before for this position. So I guess there's two ways we can go to make it simple. Does either want to withdraw the nomination or do we take it to a vote for what we want to do?
I'll withdraw Paul Wood's nomination based on the fact that he has had some challenges in attending and support the other nomination.
All right, so we now have a single nomination of Jim Lamborg for chair and John Anthony for vice chair. Without saying much, you haven't said anything against it, so we're assuming that you're willing.
We don't want to give
As
him an
long as
opportunity.
the chair shows up every meeting, I'm fine.
He carries a gun, I'm giving him.
Talking about John.
All right, so that would be the motion then.
That'd be my motion.
Perfect. And motion, we'll go with Harry Robbins' motion now for Jim Lamborg
Yes.
and John Anthony. Do we have a second?
I'll second.
Very good. Thank you.
Messing us up.
Quick go over there.
I was sleeping on the job apparently.
All right, so roll call vote for the motion for Jim Lamborg to continue as chair of EMCC and John Anthony to become vice chair effective the July 1 meeting. Roll call coming, Sam Klemick.
Aye.
Jim Lamborg.
Abstained.
Harry. Nice, I got my notes today.
All right.
All right, Harry Robbins, thank you. Jody Schaefer.
Aye.
Dr. Greenson.
Aye.
Carla Spencer.
Aye.
John Anthony.
Abstain.
And Mike Esslinger.
Aye.
Carries. Thank you.
EMS training programs, Steve.
Oh, okay. So in your packet, you will have a brief summary of some of the things that the EMS agency provides oversight related to EMS training programs. We have a paramedic training program now in the county that is in its beginning its second class. It's moving along well and we'll be starting a third cohort in November. And so far it has met all the regulatory requirements for being a paramedic program. I believe in 2024, they will be going through their accreditation to finish up, but it's essentially the initial accreditation through COAMPS, and we'll be participating in that and confirming that they've continued to meet all the regulatory requirements to provide paramedic training. We have two EMT training programs, one at Hartnell, one at MPC. This year is the year that we do the every 4-year review, and we've completed the Hartnell review, found their program to meet absolutely every regulatory and policy requirement. Found a very good program, makes excellent use of high fidelity simulation and take it to an amazing degree. MPC will be doing their administrative review at the end of this month. You'll also notice that there's a long list of EMS-CE providers. And so we'll be looking at a good number of their programs this year because their 4-year approval has come up in 2023. And then we have a couple of EMR and public safety first aid programs that will also be providing oversight and review for. So a lot of training programs to look at. So far, they seem to be doing really good work, and we're happy to have them. Any questions about our EMS training programs?
We'll hear an assessment of the MPC program at the next meeting or the following meeting.
We can certainly bring that.
All right.
One other comment. I just want to extend my thanks to all the hospitals for participating in the internship programs, especially, CHOMP stepping up and being able to have some interns working. It's a very important program for us. We've got 4 folks in that program and 3 that graduated prior. And we see that really as our way forward of attracting and maintaining a local workforce and basically growing our own paramedics in-house. It's a super important program, and having all the hospitals on board to support it all the way through has been really good to see, and I really appreciate that sincerely.
We're gonna go back to, we're actually at approval, or did we do the, oh no, we did that. We're going on to reports, number 4. We'll do.
Actually, we got that.
We'll cover that.
Oh, boy. Okay, EMS system, there we go, performance measures. Communications, Kimberly Hernandez, and actually Kimberly has several. She'll be.
Morning. So first, we're going to go over the 800 megahertz and ReadyNet testing. We're reporting on February and March. 800 megahertz and ReadyNet have remained pretty status quo with just a couple exceptions. We did receive some feedback from SVMH because a couple of their percentages for both were low. And they said they have some new charge nurses on night shift, and they're trying to review the 800 megahertz and the ReadyNet with the night shift, and also get a lot of their staff doing the ReadyNet training. So we received that feedback. We do continue to report 800 megahertz and ReadyNet to each hospital at the following month for the month previous, so they're aware of any issues that they need to address with their staff. And then I'll move on. Can I move on to, or any questions? Sorry. Okay. I think next is contract compliance. Okay. So contract compliance, this report also was in your agenda packet. I'm just going to summarize that all priorities that were reportable for February and March exceeded 90% compliance. And for MPDS, AMR is continuing to EMD over 70% of their calls. Any questions on that?
That's a big deal.
Yeah, it is. Yeah, they're doing great right now. And then I just wanted to, I think the next item, it doesn't necessarily have my name on it, but it's the fire other provider agency report. That's going to be reported in March and September. We're going to do a biannual report. So you'll see that in September. Okay, thank you.
Kimberly, I have
Yes.
just a comment.
Sure.
along the lines. Would it be possible, and I know I keep asking you for information, it's hard to get, and I do appreciate you getting that last time you were able to break it out, I guess, regionally in terms of like what the priority 1, priority 2. That's very valuable. It would also be interesting, since we're looking at fire transport, it would be also interesting to see what the response times of first response fire are, and then even possibly correlate that with the arrival of transport for non-transporting agencies. So like, we have, how long is it taking for first response fire EMS to get there, and then how long is it taking for transport EMS to get there?
Right.
And I'm sure based off of our past conversations that that's difficult. But if it's something that could be looked into at some time, and maybe moving forward, if there are different software tools or something like that available or being looked at or considered, maybe factoring that into the decision process. And where I'm coming from is really looking at the EMS system as a whole. I think sometimes it feels like we're just focusing on like what we're considering EMS to be transport, but I consider first response a vital component of that, as well as dispatch. And it would just be interesting to see those metrics.
I do believe, and correct me if I'm wrong, Teresa, that this was brought up previously, and this was something that the epidemiologist was possibly working on, but it was very. It's
Yeah,
gonna
we're
take
trying to
quite a
figure
bit
out
of time.
better ways of handle,
Right,
method
so-
of looking at the data.
Yeah, so it is something that's. being
Harry
looked
was the
at.
one who brought it up.
Yes.
Jim, your train of thought here, I agree with this completely, because up until about a year and a half or so ago, we looked only at the contract ambulance. Then we start looking now at the other two agencies that provide ambulance services. And we're looking more at the total picture. Now, you bring up a good point, because, the arrival of the first responders is part of that response. And I think it's a very critical element. And I'm trying to look at it to see how we could do that, perhaps under contract compliance is probably, that's not the realm of contract compliance. But I defer to staff to come up with a way of that we can measure that, look at that as part of the macro program. I totally agree with you.
And I guess, I mean, I too would be very interested in that information. I also appreciate what a huge amount of data that is, depending on how our system is set up. If it made a difference, maybe the level 1 and 2 calls rather than all the calls.
Right. Prioritize.
So that you're not, so that we aren't looking at all, whatever that, what was this year's call volume? 22? Yeah. Yeah. Whatever, those huge call volumes, when we're talking about the lower level calls, I feel like everybody wants somebody there as quickly as possible, but what we really care about is the ones that have been MDS as high level, but how are we doing there?
Kimberly, sorry. I had a question. When you released the report on Carmel and our ambulances, how will the data show when we respond mutual aid? Is that going to be a ding against us? Because when we're sending an ambulance from Mid Carmel Valley into the city of Seaside, it takes a long time to get there. Is that going to be eliminated from our data pool? Is it only going to be within our footprint of?
So what had been reported previously and what will be continue to be reported is within your jurisdiction overall and outside.
Okay.
Yeah.
We look at that separately.
Mhm. It is the 90th percentile. That's what's being reported.
Yeah. I agree with everything that's being said here. Jody, just from our perspective, I personally would like to look at all the calls as we sit down as the fire chiefs in discussions with the EMS agency and talking about the system. And I think all of that call data is very important to see how the system performs overall, not just in priority 1s and 2s, but it helps us make decisions.
Oh, I totally
about
agree.
response data.
I just know what, depending on how you approach the data, I know that Kimberly ends up doing a lot of manual abstraction, and I just don't see that kind of manual abstraction. Yeah.
And we work with the SO too. We work with it on the fire side, and where it actually spent a good deal of effort in training people to really dive deep into ESO and get data out of it, along with comparative data from CAD. So yes, it's a heavy lift, but it's not as daunting as one might think to get that data.
The other
Maybe there's a grad
consideration is-
student who needs a thesis project.
The other consideration is it could vary from agency to agency, and how do you put agencies either together or you do it discreetly by agency. So there are a lot of considerations when we start to look at this. But yes, that is a managerial tool, a very critical one.
As we talk in the bigger scope of priority dispatching, and again, the system going into an RFP and going into the nuts and bolts of the system, I think it's really important data for everybody to have access to. So appreciate the ask.
And on top of what you said, Sam, what I have really appreciated the coordination and cooperation that it feels like this committee is bringing to our county, and whatever we can do to continue to support that.
Yes.
Because this feels so much nicer than it has in the past.
Well, And from a
and
macro,
and effective, not
from a
just,
long-term perspective, we've overcome a lot of adversarial issues.
Yeah.
And almost an adversarial posture to a very cooperative and a very integrated effort. And I deeply appreciate from all the participants and the staff at all. It's changed. I mean, I've seen this over the past 20 years, so,
Yeah.
you know, it's light years difference.
with our data showing improvement.
Yes.
Yeah, the only thing that I would mention is that, you know, I think there should be kind of a collective body that comes together to look at how the data is looked at. Because I think that if you start maybe only looking at the priority ones and priority twos, you know, we deploy our resources, you know, system-wide for all priorities. And I think that it might not give a reflective picture of what the impacts on all the resources are. And so,
That's true.
you know, because we're using our 911 resources even for IFT work. And I think that that sort of would help paint a more broad picture. And I totally agree. I think that you can look at it from a few different ways, but I do even think that priority threes would probably be an important look at least. Because in some cases, those priority threes are still utilizing fire resources, you know, law enforcement and all of those. It's a complex issue to kind of, you know, slice apart, I think.
Just a quick comment, Mike, and to kind of jump in on what Harry just mentioned in regards to like working together, you know, and I want to just reaffirm that my rationale for bringing that forward is in no way to find holes in systems, and I agree with what you're saying. Ultimately, the reason why I'm here and everybody is here is to ensure that the best treatment arrives as soon as possible to the patient. That's what we're all motivated to do. But by looking at different components of the system, I think that helps us, you know, fact-based decision-making so that we can make adjustments as needed within our respective agencies to deliver better patient care. So, and again, the intent is not to make your life harder. I think it's like, I think there's energy here. Maybe we'll probably be taking this to fire chiefs to bring this up as a recommendation as well. But I think maybe even just philosophically looking at this as a community, that we need to be approaching this more this way, so that again, as tools become available and as we look at current tools, we can find ways to utilize them better.
Maybe we could ask the agency to come back at the next meeting and give us an idea as to what it would take. And again, staff time may be critical. We have to be very careful about how we use the staff. And Teresa and company come back and let us know what we can do in that regard, what is available.
We can agendize for next time and come up with a game plan for that.
Please.
Thank you.
On to old business. EMCC membership. Steve.
Yes, just like with the chair and vice chair needing to change every year, every 2 years, every 2 years, the membership needs to renew their appointment with the Board of Supervisors. So there's a couple things going on this year. One is we have a paramedic, Spencer Harnett, who we're taking to the board for appointment to cover the field paramedic position. And then Will Hiller, Sam Klemick, Jeff Watkins, who are bringing forward for law enforcement, John Anthony, Harry Robbins, Jody Schaefer. Your positions are all expiring here in June. I believe we've reached out to either you or your organization that, you know, recommends your position on EMCC for a letter of endorsement to say, yes, we want this person here, which we will then take as nominees from the EMS director to the Board of Supervisors. So please make sure your constituency organization or individuals, in the case of the reps, communicate with us that you want to serve for another 2 years. Big 2 years coming up. Lots of things that we're going to be listing, including response times. So exciting 2 years. Love to have all of your participation continuing with your experience. So we do need those nominees. The alternates, also need those endorsements and recommendations because the alternates, Mike Essinger, Steve Russo for law enforcement, who will be new, Bandy Smith, all expire at the same time as the primary member. So we're looking for the information we need so we can put it together under Teresa's as EMS director's nomination to the board for their appointment. Any questions about the process? So it's in your guys' court if we don't have the paperwork we need to get started. So, and we'd like to have you guys on for July, so please get it done so we can get it to the board. Earlier is better because you also have a oath of office, which for those who did last year, can sometimes take a little bit of time. So get it early so we can get the whole process done, get you guys seated for the July meeting.
And I know that we brought this item to the committee in March. We like to start in March because it can take that long since we have to get the nominations. For instance, for the fire chiefs, the nomination has come from the Fire Chiefs Association. Then we have to take it to the board. For us to take it to the board, it takes a minimum of 4 weeks. And then once the board approves them, it can take the clerk of the board 2-3 weeks to get that letter out to each of you with the oath of office that you need to that needs to be administered. So it gives us more or less ample time to get everybody seated by July 1st. Those nominations that we have not received by now there's a high likelihood that they will not be seated on July 1st because of how long we still have to take them to the board, get the oath of approved, oath of office, all of that stuff takes some time.
For the fire chiefs, we took action at our last meeting and there will be no change. And your letter will be forthcoming from Chief
We
Gutierrez.
appreciate that.
Yes. And then
And the fact that the fact that we're asking bios is a requirement of the board now. The clerk of the board notified us that anybody who is appointed by the Board of Supervisors to any committee we have to include the bio for that individual, and we made it consistent across all 3 committees.
Right, any questions? And then finally, just I want to mention Form 700. If you haven't, and there's at least one person on our committee, not mentioning names, but if you haven't done it, it was due back April 1. So if you haven't done Form 700, please get it done.
Steve, one issue under membership.
Yes.
We have some members that do not participate.
Mhm.
Has any action been taken to encourage them to participate and or replace them? The vitality of this board is driven by the involvement of the people who are on the board. And I think that's critical, but if we have positions which are filled by a nominee who does not attend, let's take some action to get that person replaced.
Let me take that, Steve. We discussed it internally. One of the things that we wanted to start doing is to attach the attendance sheet to the agenda, so that is out there. And then the bylaws do say that the committee can take action and remove the individual from the committee if they don't attend a certain number of, I think it's 75% of the meetings.
What percentage? I'm sorry.
75% of the meetings, and the committee can take action and remove the individual. Don't quote me quite on that, but that's what my memory tells me about the bylaws.
Yeah, I don't recall that, but then, yeah, whatever. Yeah, there's a
But there's a
provision.
process,
Yeah,
there's a
okay.
process that, but we discussed that internally because we have noticed on some members are not attending regularly. But that would be, our suggestion is to just attach that attendance sheet so that everybody can see. And then from there, the committee can take action.
None of us are grade scores. So, okay, my point's well taken.
Monterey County Emergency Medical Services Ordinance Review, Deborah.
Yes. So I think, as everybody's aware, we've been working through updating our ordinance. That process is still ongoing. We've been meeting regularly with county council and reviewing various sections and language. Our plan is to bring a copy of that ordinance to this group in July for your review. So your comments on that. So happy to answer any questions on it, but it's still ongoing.
When you bring that forward, is there going to be a way to call out what the changes are rather than?
Yeah, we're working on putting together a red line version so you'll be able to tell me.
Other questions? EMCC annual report to the Board of Supervisors.
Yeah, and actually, before that, our general kind of 2022 EMS annual report, these both go hand in hand. So in your packet, there is a draft of our annual report for 2022. That plan is to be submitted to the Board of Supervisors, and then we do a presentation on the report as well. We are presenting the draft to you. We know it just came out on Friday, so you haven't had much time to review it. So we are asking for those of you who haven't had a chance to review it yet, that you take some time between now and the next EMCC meeting, review that report, that plan, and give us any feedback. And we'd like to come back at the next meeting for endorsement of the plan. So this is kind of your heads up. Please take a look at it and spend some time so that you can.
Good, we have a comment. Did read through. It's very good. Appreciate it. I'd like to make one recommendation on page 14, where you're describing the EMS responders. I don't know if we should consider emergency medical dispatchers as part of the responders. We have EMRs, we have EMTs, paramedics.
Okay.
Just a thought. I don't know how the rest of the group feels about that.
I read in the report and agree that one of the significant challenges is the behavioral health and the not ALS, the nurse transports that, and I know that you guys are working on coming up with solutions. When do you anticipate new solutions in a report?
Jody.
Sorry.
We have been exploring different options, and we have had some conversations with the hospitals as well as with AMR. I mean, one thing that everybody has heard at this meeting is that there's no one solution to most of the issues that come up, and so we're still in conversation. I think it started with us opening up like transfers, IFTs. They used to be done with just ALS ambulances, which is a huge drain on resources. We opened it up to BLS. We've done some survey, sort of an informal survey with some of the receiving facilities for behavioral health patients, and just to see, do they always come in via ambulance? And they said, no, there's all these different ways in which they bring the patients. I think it's a combination of things. We can propose and bring, but it's also how open we are to change. And I understand, we completely understand being conservative in an approach, because we are dealing with individuals' lives. So we sometimes have to take baby steps in that progress. We also know that for like the ambulance provider, some of these transports are placing a high safety concern for the staff. We've all heard about what's been happening lately. So it's like, how do we, as an EMS agency in the middle of all of this, balance the needs of all of the different stakeholders, along with meeting the needs of that patient? So we are hoping to be able to bring more options, exploring those. I think that maybe as part of, depending on how the responses that we get to the SWOT analysis, I think that some of that is probably going to come up. I'm hoping that it does. That in the feedback that we get from the system, that the issues and proposed solutions are there. Our goal is to bring the SWOT analysis once it comes back, the results of that in July, and perhaps at that time we can have a little more open conversation about it.
Because it sounds to me like any significant change would be a change to the contract as well, and how we would approach that.
Yes.
If there are no other questions on the annual report itself, you'll also find in your packet a annual report drafted on behalf of the EMCC for 2022 as well. The Health and Safety Code requires EMCCs throughout the state to annually submit a report to sort of their supervising body. So in this case, the Board of Supervisors, detailing their activities for the previous year. So we have prepared a draft report on behalf of EMCC based on the guidance given at the last meeting. A copy of that is in your packet for your review. And again, we would bring that back in July, which is for endorsement of that. And then that would be forwarded along with the annual report to the Board of Supervisors to fulfill that statutory requirement.
And just to remind the group that when we brought this up in March is when we told you that, as we're doing our own internal review of our processes and making sure that we are meeting all of our regulatory obligations, that we realize that there's this requirement for the report. And not having found anything on file that had a separate report from EMCC, we can only assume that the annual report was that intended to comply with that requirement. We have suggested just adding a piece to the annual report on behalf of the EMCC. As we were working on it, it seemed like, it fits as a standalone report. So that's why you see it separately. And normally we seek your endorsement at this meeting, but because of this addition, we wanted to make sure that the committee has ample time to review and comment, and especially on the report from the EMCC, that you guys get to review it and provide your input so that we can make any revisions that you might want to see. We wanted to get that out to you earlier, but with the storms in March, it took the entire team's time to coordinate the response. So it delayed our finishing the reports and sending them to the committee.
Deborah had a question about in the report in reference to the CSA 74 special tax.
Yes.
Says, as a result, the EMS agency has been exploring the implementation of fees to generate additional revenue with the goal to maintain fiscal. Are those fees, like, you're not looking like charge the first responder agencies fees to accreditations and that type of, that's not on the table as fees, right?
We have looked at the fees that lends us across the state charge, and it's everything from trauma fees, STEMI, stroke. There is a fee for processing the applications for certification and accreditation of EMTs and paramedics. The goal, ultimately, the goal for any program from a financial side, of course, is for programs to be self-sustaining. That is not the goal. We do have the CSA 74, but as you saw on the report, the CSA 74, as it was established as a special tax in fiscal year 2001, has not changed. Yet the cost of providing these services, the cost of doing business continues to increase. Right now, at the present time, we only charge one fee, which is to the trauma center. And that one was established when the trauma center was designated as the trauma, that was designated as a trauma center. So we have looked at a wide range of fees that we are either one of the few or the only EMS agency in the state that does not charge. And the goal is one to spread the burden of the cost across the board, is so that no one entity feels a heavy burden, balance it with what we already have. But in terms of EMTs and paramedics, the only thing that we want is to try to recoup some of the costs for just processing the application, which may be just maybe an hour of our time. So we try to be mindful of the fact that the state also has a charge for that. So that in terms of that type of fee, that is what we are looking at, just the processing, the processes of the application. We are also, because we're also looking at a database to manage the EMT and paramedic applications, and to be issuing actual cards, for the people who are in our system. We're just trying to recoup some of the cost.
So basically, we're looking at like because we get some CSA funding, right? Like our organization gets $50,000 annually. So essentially we'll get our 50,000, but then put it right back into the fund. I mean, that's a way to look at it in a sense.
Those are not being charged to the agency. For the processing, processing of the application would be to the individual paramedic, EMT or paramedic.
Well, I know our agency pays for all the certifications for our providers.
Yeah.
So I mean, it is an agency cost. It's not an individual cost. That's what we're asking.
Right.
Thanks for the clarification.
Thank you. Okay. Moving on to announcements for the good of the order.
So we do have one announcement, just to congratulate Kelsey Scanlon, as appointment director of Department of Emergency Services. She also, by being director, will be appointed after we move through the process to the ex officio position at EMCC. So we hope that she'll be joining us also.
Her background available.
Her background?
Yeah.
Not yet. We'll bring that when we move her forward with the
She's
nomination.
right?
What's that? She's ex officio.
She doesn't need appointment,
Cool.
but maybe next time we bring her.
Yeah, we'll bring her info to this member.
Let's double check with Susan, but that's what my memory tells me from when I used to handle it. Let's just confirm.
We're good. Anybody else have anything? I have a quick request. I guess, I don't know if this would be a future agenda item for additional discussion. Or not exactly how, but I would like to make a request that the EMSA work with the ops committee and the medical program director, come up with policy and or protocol to address, apologize for the terminology here, but what we in our black humor call a frequent flyer situation, where we're called to situations where repeatedly where EMS may not be the most appropriate resource. And I think that with the brains that are in this county, there's going to be enough creativity, and the fact that I'm sure that other counties and systems have addressed this before. I've worked in one, but we come up with something to assist us with that. I know that we in our jurisdiction dealt with one earlier this year, and it was very challenging, and it didn't feel like there was a lot of resources that I could depend upon within the current system. So I think that would be something that we should look at. That I'll see if there's any other comments. Okay. Next.
I want to thank you for stepping up to be chair second year in a row. I don't think I've ever seen that before. It's very cool.
It's the only person dumb enough, right?
Go for it.
Okay, next meeting, the next regularly scheduled meeting is for the EMCC is July 12th, but we do have a special meeting on June 21st to review and comment on EMS ordinance revision. Or that is tentative, but we'll be hearing about that.
Yes, we were to give this group adequate time to look at the ordinance and comment on it. And then also, through seeking endorsement, we'd like to bring it, hopefully we'll have everything ready to go by June 21st. So we're planning a tentative EMCC meeting for June 21st to bring the ordinance to this committee, and then the regular meeting on July 12th. We hope to receive an endorsement on it.
If we have, I'm sorry.
Well, we have the group here. Do we want to look at our calendars to ensure that that's a good day?
Is that a Wednesday?
Yes, we're trying to keep Wednesday, just same time.
Would it be possible to then bring for endorsement the annual report? Because then that's whenever we get endorsement from here, we could get it to the board for approval.
We would schedule a special meeting, identify those two items.
Does it work for you, Sam?
Same
good.
time. Steve?
Same time.
There'd be a Zoom option.
Not for members. Unless the state regulations change.
Any other? Okay. We'll move for adjournment. Yeah. 21st, possibly.
You'll go get your books now, Tanya.
I'm excited. One of my